So one of the first things I did when I came into the North West was to build on the preparatory work that the AHSN had done in terms of reaching into Europe, and we developed a strategic approach which is around taking benefit from our engagement with the European community. And that involves building European connections and investing time. So we've made a commitment to invest time into building those connections and bringing knowledge into the region. Obviously, we're involved with the funding, and we want to attract money to the region. But we're building it along a number of other pillars to help us be successful. And part of that is about raising the profile of the North West Coast. So we have a policy where if we're engaged with any activity in Europe, we're not just a delegate, we're not passive. We chair sessions, we present, we host discussions, and so we're trying to be active and raise our profile with our partners. We're trying to build local and regional and national, and even taking the knowledge and the work that we're doing into the global arena to make maximum benefits. And we want to ensure that we've got capability and capacity within the region, because it's been mentioned a couple of times already that the NHS are not experts in this field. So we think it's really important that we help to develop that capability and capacity. And it's also important that we've got an identity. I mean, you'll hear when we speak in Europe that we call ourselves the North West Coast of England. We need people to be able to relate to us really quickly and understand where we're from. And also the benefits of the regional footprint. It's been mentioned a few times already. We cover a population of 4 million, and that's not an insignificant size for a region. It also helps in terms of bids if you've got a regional structure supporting you. And to date we've done quite a lot in terms of helping people with bids and offering letters of support and encouragement for those. So we are members of a number of networks. The two we're most active in is the Coral and the ECH Alliance. So the Coral's a community of regions for assisted living. They've recently had a day where they took their European partners out of their environments for a day and looked at what is the strategy for that network, how are they going to become most effective, how are they going to have an impact and measure that impact. So we played a role in that with representatives from our European reference site from the Liverpool team. We also use the European Connected Health Alliance website as a platform to share what we're doing in terms of our health ecosystem work with potential partners across Europe. And that's quite if you've been on that website, it's got quite a lot of information on it and a lot of detail about the other partners. In terms of bringing knowledge in, our medicine optimisation programme is a programme that we've recently initiated with partners from the Netherlands, and a product that's been trialled and is operational in Northern Ireland. So this is about the sort of bringing knowledge and expertise in. We like to think that we're seen as an active partner, and one of those measures is when people come to us for contributions outside of the norm. So we were asked to lead a number of AHSN's input into a recent document about funding streams. And we looked at the other HSNs that are active in this area to try and give a picture of what we think is important for going forward. The roundtable event, there's a number of organisations and structures within the system in our region that have an interest or a role in terms of the European agenda. We brought those partners together to explore where their interests lie, where their expertise lied, so that when stakeholders come to us, we can actually signpost people if there's somebody else in the region with more expertise or a stronger interest in that area. We think that's important because our stakeholders need to know where to go, and we need to make sure that they're getting the right advice and access to the people with expertise in that area. And the final one there around, we recently presented our ecosystem work to the World Health Design Forum, and that enabled us to link with other partners and to, again, raise the profile of the work that we're doing. So we've got a lot of activities in this area. Liz mentioned earlier about our Innovation Scout programme, which we launched earlier this week. One of the messages that came from them was around the capability and the capacity of NHS staff and building up the knowledge base from operational staff and within board. So that's something that we're going to take forward in terms of our engagement with the NHS. But we also want to maximise the benefits from other resources. So people like Michael, he's an expert in this field compared to us, so he comes here quite a lot. So we want to make sure that we're not reinventing the wheel. We're using the capacity we've got in the organisation to maximum benefit and bringing the expertise in where we can. Our work around assisted living, we're going to be looking at examples, for example, living labs. So we've got a community of people interested in that as a model, and we're looking at how we can expose them to that benefit. We're looking at also how we can share the intelligence, so we can raise general awareness and help to exchange information across our partners. We obviously want to promote funding, we want money in inward investment into the region, and looking at other service models like how we can support our integration work with models from Spain, for example. We've also been asked by our local partners to bring together people working in the assisted living area to create a network so that they can better develop their contacts within the region and look at other wider collaborations which would help to strengthen that brand and that expertise that we're known for. And we also want to export our innovation. That's another key strand about taking the good work that we've done out to potential adopters in Europe. So again, by the investment we've made in creating a profile and being out there and engaging, it gives us better opportunities to promote the work that we're doing. And that's all I want to say about where we are today.